Hello and welcome to another episode of this ongoing season that we have on Facebook, in which we bring a specialist to you to discuss an issue of concern to you, to your families, or to a person that you may know of, or even if you just want to increase your knowledge and information around the subject of health. And we do so by bringing incredible information through the experiences of our wonderful faculty at Indraprastha Apollo Hospitals. And this week is no different. I am delighted to be joined by Dr. Ranjan Modi, Senior Consultant Cardiology at Indraprastha Apollo Hospitals. Dr. Modi, welcome to our Facebook Live session.
Hi, Dr. Karan. Thank you so much for the wonderful introduction.
It's wonderful to have you. And for those of you who may not know Dr. Ranjan Modi, he is an expert in not just only the field of cardiology, an expert clinician, but also someone who is always looking and exploring the newer sciences and technologies, interventions that are available for us to keep our heart safe. And this week I'll be discussing with him Tavi-Tavr. Now, these are some cutting-edge new technologies which are available. If you are a patient who has suffered from cardiac illnesses, I will get Dr. Ranjan to explain to us whether you are a fit case for these new technologies and new interventions which are available amongst other places at Indraprastha Apollo Hospital. So, Dr. Ranjan, welcome once again to this Facebook Live session. And since it's such a alphabet soup for us, Tavi-Tavr, can you just explain to our viewers what are these things?
Dr. Karan, so Tavr or Tavi is approximately the same thing. It's just the nomenclature which is different. So let's just expand these terms. So Tavi is basically transcatheter aortic valve implantation, and Tavr means the same almost, which is transcatheter aortic valve replacement. So these are procedures where we are removing the narrowed aortic valve and replacing them with a newer valve through a minimal invasive technique. So we are implanting a new aortic valve at the aortic place or replacing the old aortic valve with a new valve.
Right. So I think many people are aware that heart there are about 4 chambers, and blood goes out and blood comes in. I think itna basic information to sabko hai. But if you could just explain how does the valve and how do they play a role? What is their role in your heart health?
So, aap imagine karo there's a house which has 4 rooms. So, heart has 4 rooms which are regulated by doors. So, we have 4 doors which are respectively the mitral, the tricuspid, the pulmonary, and the aortic. Now, ye doors are leading to blood vessels which carry blood to different areas. Like when the blood comes in, it goes to one room. Wahan se it goes to another room, goes to the lungs, to the pulmonary valve. Lungs may get oxygenated. It gets purified, oxygen enters that blood, it comes back to another room, then goes to the final room, which we know as the left ventricle, which is the most important place from where the heart pumps the entire blood to the body. Now, from the left ventricle, when it goes to the main vessel, which we call as the aorta, there is a door which is known as the aortic valve. Now, the aortic valve controls the blood supply to the entire body. So imagine if the door is stenosed or narrowed. So आप imagine करो जितना blood जाना चाहिए पूरे शरीर को, to the brain, to the kidneys, to the liver, every possible part of the body, जितना भी blood जा रहा है, that becomes lesser. And all the organs need oxygen, they need nutrition, which is just carried by blood. So एक बार वो दरवाजा narrow हो जाता है, so they are not getting proper nutrition, they are not getting proper oxygen, they start to not function well, or that what we call as organ dysfunction. So ये aortic valve basically is very, very important because इसी से सारा आपका blood जा रहा है सारे organs को. So it is very important for survival of the entire body.
So ये condition होती क्यों है और किन लोगों में पाई जाती है?
So basically आप ये सोचिए कि जैसे जैसे दरवाजा पुराना होता रहता है, most common part is it starts getting rusted, खुल नहीं पाता, आवाज करता है. That's a common thing which happens in most of our houses. So similarly, ये जो valve है is like a door. Every time the blood passes through it, it opens up, and जब blood pass होना रुक जाता है, तो it closes back again. And slowly and steadily, जितनी उसकी opening और closing है, उतनी नहीं रह पाती, so it opens and it doesn't close in the same amount of caliber as it's supposed to be. So open भी इतना ही हुआ और close भी इतना हुआ, जो normally इतना open होता है वो इतना ही open हो पा रहा है. So उसका total area diameter जो है जिससे blood जाना चाहिए, तो opening कम हो जाएगी तो amount of blood going out becomes less. So most common is always age related. जैसे जैसे आप ओल्ड होते रहेंगे, जैसे जैसे आपकी एज बढ़ती रहेगी, वैसे वैसे वो दरवाजा रस्ट होता रहेगा, and that leads to what we call as aortic stenosis. Stenosis means narrowing of that aortic valve. This other more common conditions are, a lot of people have something known as a bicuspid aortic valve. Bicuspid लोग बचपन से तीन लीफलेट्स की जगह 2 लीफलेट्स होते हैं उसमें, तो ऑब्वियसली उनके एरिया ऑलरेडी कम होता है, सो एज एज प्रोग्रेसेस एरिया और जल्दी कम हो जाता है. ठीक है. पीपल हु हैव लॉन्ग स्टैंडिंग हार्ट डिजीजेस, उनमें ये होता है. रोमैटिक जो मोस्ट कॉमन एक वन ऑफ द इन्फेक्शंस इन इंडिया है, जिसकी वजह से हमें कई बार पेनिसिलिन के इंजेक्शंस लगते हैं. रोमैटिक इटसेल्फ कैन कॉज aortic stenosis. But out of all these conditions, age related aortic stenosis is one of the most common. So जैसे जैसे आप ओल्ड होते रहेंगे, aortic stenosis will take place.
Right. और इसके क्या symptoms होते हैं? If somebody were to turn up, how do you basically diagnose, or if you feel that you have this problem, how would you diagnose it?
So 3-4 common symptoms हैं which most of the patients present with in a heart problem. सबसे common symptoms है सर सांस फूलता है. If I walk a little fine, then मेरी सांस फूलने लगती. पहले नहीं फूलती थी, but अब मैं stairs चढ़ता हूँ, one flight of stairs also, एक floor तक जाता हूँ, I start feeling breathless. Second is obviously angina या chest pain जिसे हम बोलते हैं. Sir, पहले I never used to have this chest pain, but if I walk a kilometer now in my morning walks, I start getting this heaviness, weird kind of a heaviness or a weight on my chest, जो रुकने पे ठीक हो जाता है, but when I start walking, it comes back again. So any kind of exertional breathing difficulty or exertional chest pain means exercise पे जो हो रहा है, those are most common symptoms of cardiac. In addition to this, if you have syncope और जिसे हम चक्कर बोलते हैं या वर्टाइगो बोलते हैं, अगर वो हो रहा है, then again it attributes mostly to aortic valve diseases. Now all these 3 symptoms can present in any cardiac condition. Whenever these 3 symptoms are there, we need to be confirmed it by an ECG and an echo. So echo is basically an ultrasound of the heart, जो हम लोग बहुत commonly आज लोग जानते हैं echocardiography क्या होती है. So basically हम heart देख रहे हैं, heart के सारे chambers देख रहे हैं, उनमें अगर आपको aortic stenosis दिखी है, narrowed valve दिखा है, then we are sure ये symptoms aortic valve की वजह से हुआ है. So if you have any of these symptoms, we need to get investigated by an ECG and an echo after meeting a cardiologist, and they will confirm कि आपको तकलीफ क्या है, कि aortic stenosis है भी कि नहीं.
Right. So Tavi-Tavr I'll come to, but उससे पहले अगर 10-12 साल पहले अगर आप किसी पेशेंट को ऐसे डायग्नोज करते, so typically what was the intervention done?
Okay, so we have advanced a lot पिछले 10 साल में, and TAVR I think is one of the biggest advancements. ऐसे patients में जब भी valves की problem होती थी a few years back तक, all used to have open heart surgeries because कोई और तरीका नहीं था to replace the valve. So you had to open up the sternum. Sternum open क्या है, इसे हम open heart surgery बोलते हैं. You get a cut, it opens up, you reach the heart में जाके you put a new valve there. That is always what was always done. Now recently, because we have got technology has advanced so much, research has advanced so much, now we do not need to do open heart surgeries, which is TAVR, which is an minimally invasive valve replacement. जिसे हम पैर से जा सकते हैं, we reach up to the heart through the aorta and we can place a valve there. So that से फायदे क्या होते हैं, एक तो open heart surgeries नहीं हो रही आपकी, and then your recovery becomes faster. It is something like the stent, जो हम पैर से पहले जो stent करते थे. Similarly, we are taking the valve and going and putting it there.
So आपकी TAVI procedure में basically you're replacing the faulty valve with a new one.
With a new valve, exactly.
Right. And when this happens, what is the change in the person's life? जो आपने symptoms बताए and post surgery, what happens?
So ये सारे symptoms are happening because the amount of blood जो उस valve से निकल रहा है that is decreased. So जब आप ये सोचो एक आगे ओपनिंग बिल्कुल पतली हो चुकी है and there is a heart which is trying to pump through that small opening. So obviously दो प्रॉब्लम, एक तो ब्लड जितना जाना चाहिए दूसरे ऑर्गन्स को नहीं जा रहा है. Second, the heart is getting a lot of pressure because it's pushing the amount of blood through a opening which has become very, very, very small. So दो issues are resolved. One, all the organs, once we open these valves, get a good blood supply. So बाकी organs अच्छे काम करते रहते हैं because they need blood supply for function. Second, the heart के ऊपर जो pressure पड़ रहा था, that decreases. So ये जो सारे symptoms हैं आपके सिनको या जिसे हम चक्कर बोल रहे थे, चक्कर happens because brain is not getting enough blood supply because the opening of the valve is decreased. So एक बार वो open हो जाता है तो चक्कर खत्म हो गए. Dizziness and chest pain, ये सारे भी खत्म हो जाते हैं because the heart के ऊपर जो pressure, part के ऊपर जो pressure पड़ रहा था, while pushing it through that narrowed valve, वो कम हो जाता है. So all these symptoms vanish. Plus, because we are doing a TAVI instead of an open heart surgery, आपकी quality of life improves drastically. Imagine अगर आपका open heart surgery आज भी करेंगे हम, तो भी even after so many years of surgery being advanced, it takes about a week for you to come out of the hospital, and it takes about 15 days for you to get back to your routine practices. TAVI के साथ फायदा ये है कि आज अगर मैंने आपका ऑपरेशन किया, 2 दिन बाद में आपको घर भेज सकता हूँ. आप घर पे हो, आप within another 2 days आप सारा अपना काम शुरू कर रहे हो. So the amount of time spent in the hospital reduces. The amount of time spent for improving a quality of life decreases drastically, and complications related to open heart surgery like wound nahi jama, yeah, the pain or the huge stitches which are put here completely vanish. So I'm entering the hospital with such a important thing जो मेरी open heart surgery करनी पड़ेगी जिस चीज के लिए, उस चीज के लिए I'm getting a valve replaced and I'm out of the hospital within 4 days and I'm back to work. So that's the best part.
Right. So that's really miraculous in that sense that it can fix so many things and also get you back to back on your feet and back to your usual routine so quickly. And typically, what is the age of this valve? I mean, does it have a end life? I mean, do you have to replace it again? Typically, how would you look at it from that standpoint?
So ये सारे valves are similar to the valves जो open heart surgery में use होते हैं. Open heart surgery basically used to use always 2 valves. जैसे हम एक metallic valve बोलते थे, which requires blood thinners to be continued throughout your life, और एक हम bioprosthetic या tissue valve जिसे बोलते हैं. Now all these valves used in TAVI or TAVR are bioprosthetic or tissue valves. Bioprosthetic tissue valves generally, even in open heart surgery, जितना हमारे पास data है for the last 30-40 years of open heart surgery, have a life for about 10 to 15 years. At present, जो TAVI data हमारे पास है is of the last 10 to 12 years, which has shown the first valve which was put has still continued to be there in the last 10 years. So, open heart surgery वाला tissue valve and TAVI का tissue valve have approximately the same age. It is not कि हम TAVI करने से हम ये valve जल्दी खराब हो रहा है. They are the same age. So 10 to 15 years, we assume nothing should happen to the valve.
Right.
Imagine this, a lot of people do not agree for a bypass. Why? Because it's an open heart surgery. So they say कि stent लगा सकते हो, stent से काम चला लो. Same thing is with TAVI. You do not want the open heart surgery or bypass. आप एक TAVI replacement करें. So similarly, like we used to put the stents, exactly same तरीके से now we are putting the valves there.
Right. And आपका ये जो 10 year का data है, your own clinical data and also published data, what has the success rate been like? Is there any failure rate also or any downsides?
No, very rarely there have been any failure rates. All the data which has been there has shown tremendous success rates, because एक बार आपका valve बैठ गया वहाँ पे, then it's done. You don't need to. It's something like a stent. आपने एक बार stent लगा दिया तो artery खुल गई, blood flow अच्छा हो गया, heart attack के chances खत्म. Similarly, TAVI के साथ once the valve has been put, the aortic stenosis vanishes, and then you have amazing quality of life. So complications जो भी procedure related complications हैं वो open heart और TAVI दोनों के साथ हैं, which are always there. But all the data which has been there for the last so many years on TAVI has shown that it is one of the biggest procedure changes which has come in the last decade.
Right. And once a patient has undergone this procedure, what are some of the precautions that they need to take, say, for the next week, for the next month, and for the next year? If you could just break it down into those milestones.
Nothing. Start running. So the precautions will happen when you have a bigger procedure. Precautions, आप stent लगाने जाते हो. Most of a lot of patients come to us. It's a stent लग गया. What our thing is, you get discharged after a stent today. After 2 days, you start going to work. Similarly, TAVI के साथ what our practice in this hospital is, you get admitted 4 to 5 days in the hospital. You get out of the hospital. 2 days later, you are supposed to go back to work. We tell you to go back to work. Even after the procedure is done, once you shift it to the room, 2 दिन बाद जब आपको रूम शिफ्ट करते हैं, रूम में आपको चलना है, आपको घूमना है. You have to walk around in the hospital because we want that valve to keep functioning. आप imagine करो गाड़ी आपने ठीक कराई, आप गाड़ी चलाओगे ना, once you put it back again, वो again rest होने लगेगा. We don't want that. So we want you to do. So there are no precautions which need to be taken. General cardiac precautions जो भी होते हैं, low fat, diabetes, hypertension, those need to get controlled because of general cardiac problems. But per se, aortic valve does not need to get anything done. You get the valve, 2 days, you start walking, 3rd day, you start running, swimming, jogging, cycling, go out of the country. So I remember we recently had this patient, हमने उसका TAVI किया. After a month, he was like, sir, he video called me and saying, sir, I'm in Greece, I'm roaming around and मैं 1.5 kilometer चल रहा हूँ with my grandson. And it was an amazing story which we had. And not this, we have had other stories where the people जो टॉयलेट तक नहीं जा पाते थे, they are now walking 2 kilometers in a day, and they are all 75, 80, 85, 90 years old, and they're walking 2 kilometers in a day, and they're so happy. They're able to do all their routine activities. They can get up, go to the garden, take a walk, spend time with their families, spend time with their grandchildren, and that gives such a big amount of peace in our head कि यार हम लोग ऐसी चीजें कर पा रहे हैं लोगों के लिए, which is amazing.
Right. What an inspiring story. So viewers, if you do have this condition or you do suspect this to be the problem with you, do get yourself evaluated. Please do reach out to Dr. Modi for his assessment and get this type of a procedure done so that you can have that quality of life back. Dr. Modi, I also want to ask you, you spoke about it being age related. So obviously this is for the older people and the sort of the older generation of cardiac patients. But आपने क्या ये procedure younger patients में भी use किया है?
देखिए, one of the first things which we always do in TAVI is older patients with, obviously we do not want to do open heart surgery because the complications become high. So obviously that subset becomes separate. Younger patients may, suppose somebody's undergone a bypass previously, at say let a 55, 60-year-old, जिनका पहले bypass हो चुका है या valve replacement हो चुका है, that means उनका chest open हो चुका है already एक बार. So reopening the chest for any procedure, always, if it's the second time, always carries more high risk. So in such patients, complications of repeat open heart surgery is very, very high. In such patients, we always say that yes, in these patients, in this की open heart surgery जिनमें बहुत risky है, उन patients में TAVI is always a good option. Because complications related to a reopening of the chest might become fatal. And we don't want to take that chance. So, अगर आपका एक बार bypass एक बार ये हो चुका है, and then you again have to reopen the chest because of any reason, maybe lung problem, maybe anything, and आपको valve replacement चाहिए, so TAVI is one of the best options. So, except that old age subset, any patient who has high risks of surgical problems of open heart surgery, they have to undergo a TAVI. That option should always be open.
Right. And if anybody is sort of considering themselves to be a fit candidate, if they were to come to you, typically what would you be doing in terms of a workup? You touched upon it briefly, but for the clarity sake, if you could just brief what you do.
So the workup includes basically routine investigations, which are ECG and echo. ECG echo से we diagnose and confirm कि aortic stenosis है भी. Do we need to intervene? Do we really need to change the valve or not? A lot of times we do not need to change the valve. We only change the valve after a critical point. Once that is done, then we take what we call as a CT aortogram. It's like a CT scan जैसे head का होता है वैसे ही हम लोग करते हैं. So aorta is the biggest vessel जो heart से निकल के पूरे brain से लेके legs तक सबको supply देती है. We look at it completely from the heart into the valve to the aorta to the नीचे पैर तक, because we need the diameter of the leg vessels also, because the valve goes from the leg vessels. So we take a picture of the CT aortogram, which gives us the entire information. Then we always have what we call as a cardio meet, which includes a cardiac team meeting, which includes a cardiologist, a cardiac surgeon, a cardiac anesthetist. These all get down, and the radiologist who looks at the CT aortogram, we all get a meeting together where it is discussed what is the better strategy for the person. Should he undergo TAVI or TAVR, he or she, or a surgical candidate which be easier? If the surgeon feels no, his surgical risk is high, मतलब दोबारा ओपन हार्ट करना बहुत मुश्किल होगा, then obviously he becomes a candidate for a TAVI or a TAV. Then with the meeting of the radiologist, the anesthetist, we all come to one conclusion कि कौन सा valve, क्या size, when, and what are the prerequisites which are needed. So all those things have to be taken care together as a cardiac team meeting.
Right, right. So with that, Dr. Ranjan, I want to draw this wonderful conversation to a close. Thank you for enlightening us subject on Tavi-Tavr and how you actually go about it and the change and impact it can have in the life of a patient. So thank you for your time.
Thank you, Dr. Karan. Thank you so much.
That was Dr. Ranjan Modi, who was having a fascinating conversation on the newer technologies which are now available, like Tavi-Tavr. If you do want to get some time with Dr. Modi or want to set up an appointment, the ticker below has all our details. Please do DM us or call our landline numbers. Multiple lines are open. Please do ask for Dr. Ranjan Modi and get an appointment and get yourself evaluated, because these treatments need to be done under expert hands and also with people who have a body of work behind them, like Dr. Modi. So thank you, Dr. Modi, once again. And thank you, viewers, for joining us this week. Next week, we'll be back with another specialist and another subject. Till then, stay happy and healthy. Thank you.